Okay, before we do anything else, we want to identify the sex of our pigs. And the way we're going to do this is we're going to take our pig, we're going to flip it up onto its dorsal side, and we're going to look at the posterior end towards the anus of the pig. If I take the tail and just flip it over, on a female pig, I'm going to notice a fleshy protrusion here. This is not present on a male pig. This is called the urogenital papilla, only present in the female. This is the obvious identifier that this would be a female pig. If I go to the male pig and I look at that posterior end, there's the anus, and just ventral to the anus, I don't see any urogenital papilla like I did on the female. However, what I can see on the male is a urogenital opening located just below the umbilical cord, right here. This is where the penis would come out of in the male. Females do not have a urogenital opening up here. The urogenital opening on a female is actually located inside of the urogenital papilla, right there. There is no urogenital opening up here. Okay, and that's how you're going to identify the sex of your pig. Please take some time to do that right now. Alright, so because we're going to be using these pigs for the next 8 weeks, we want to get these things secured down onto our tray. So what we're going to do is we're going to take some string and we're going to tie it around the front legs and the hind legs and basically secure the pig to the tray so that when we're doing dissection it doesn't move around, it just makes it easier on us. You're going to get some string. You're going to want to make permanent knots around each leg. So I'm going to tie a knot around one leg. Remember, you're not untying these ever again, so make them permanent. I'm going to take the string then, I'm going to run it underneath the tray. Don't be afraid to push the legs down, it's okay. You want to be as tight as possible so it doesn't move around. And then I'm going to take the string and tie it around the other leg. So that my pig is then securely fastened down. What I'm going to then do is tie the hind legs the same manner, and then that's going to get your pig tied down. Alright, so now that we have our pig tied down, and notice how it's tied down securely, the legs are spread open, everything's sort of visible here, so that when we get into the dissection we have access to all this area. Also, what we've sort of done is because these knots are permanent, we've also kind of created some handles. So if I take, when we're done, every day when the dissection's done, we can sort of take the string and we can just slide it out from under the tray on both sides. And we sort of have some handles that we can use to sort of lift our pig up and place it into our plastic bag as such. And the strings, notice, stay with the pig the entire time. Goes in the bag, push all the air out, zip it up, and we're done. Okay, so our first dissection is going to be of the abdominal cavity. Our first incision is going to start at the anterior portion of the umbilical cord, right around here. So we're going to start the incision. Now we're going to go ahead and make a cut from here We're going to go around the umbilical cord, okay, on the right side around the umbilical cord, and we're going to follow the nipple line. So follow the nipples all the way down, and then when you get down to this point, we still want to stay off center. We don't want to come back around and then come into the center here. We don't want to cut important things that are underneath. So we're going to come around, follow the nipple line down, staying slightly off center until right about here is where we'll end the cut. We don't want to go too far, but right about here. So again, anterior portion of the umbilical cord, cutting around, following the nipple line down, staying slightly off center, and ending our incision right about there. Okay, so I'm going to demonstrate that now with the scalpel. And it might be helpful to have your partner hold the skin tight as this is going on, or pulling up a little bit on the umbilical cord. So again, I'm going to start my incision at the top anterior portion of the umbilical cord. Okay. And I'm going to make a cut around, following the nipple line down to about there. Okay, now notice I haven't actually cut all the way through yet, sort of a top layer. You want to be gentle with this incision. You don't want to go too hard because you'll cut the organs underneath, which is what we want to identify later. So you're going to be very gentle, make superficial cuts first so that you can see what's there. Then use your fingers a little bit to sort of pull apart the tissue and pull apart the cut. And then go back to the scalpel. Okay. And now I've actually cut through, and I can see the underlying organs under that cut. So your teacher's going to pause the video here and give you further instructions on how to make this incision. Okay, before we move on to the next incision, some of you may have a pig that has a lot of fluid coming out of the incision, like we do kind of here. Notice how we have a lot of fluid coming out. To make it clearer and easier to see as we proceed, what you want to do is take some paper towels and just dab. Just dab the incision, squeeze a little bit, continue to dab, removing as much liquid as you can so that it's clear and easy to see as we proceed. Okay? Just makes everything a little bit clearer. Okay, for our next incision, what we're going to do is we're going to start basically at the same spot that we started the previous incision, so which is up here at the anterior portion of the umbilical cord, except this time we're going to cut up towards the posterior part of the rib cage. So what you want to do is palpate with your fingers, feel with your fingers where that rib cage is. You'll feel that hard bone. That's where you're going to stop the incision. So really your incision is a very small one, from the anterior portion of the umbilical cord just up to where that rib cage starts at the posterior part. So that's your incision right there. Another word of warning, there is an umbilical vein located right underneath the skin here. Okay, if I point this umbilical vein out, it's this vein right here. We don't want to cut that. We want to keep that intact. So as you're making this incision, keep your eye out for this. We don't want to cut through it. Okay. So I'm going to demonstrate what this incision is. And always make sure when you're doing your cuts to cut away from your hand. So I'm going to start my cut here, and I'm going to make a cut up towards that rib cage. Okay, so again, I'm making superficial cuts at first, sort of break through. Don't want to go too deep. Okay. And I can again use my fingers a little bit to pull it apart. Go back with the scalpel. Again, sort of holding up on the skin to pull it away from the internal organs so I don't cut through and damage them. And I've got through most of the tissue here. There's one last little layer that I can just sort of cut through. Notice how I'm being very careful to avoid the umbilical vein, which is right here. So I want to pull that down so that when I make this last cut here, I don't actually cut the umbilical vein with it. Okay. So there, now I've made my cut all the way up. My umbilical vein is still attached. And I've made my cut up to the posterior part of the rib cage. And now I'm starting to see some of the organs underneath. Your teacher's going to go ahead and pause the video here and explain further how to make this incision. All right, for our next incision, again we're going to be starting in the same spot up here on the anterior portion of our umbilical cord. This time, we're going to be cutting around the left side of our umbilical cord. We're going to follow again the nipple line down. As we get lower and lower, as we get more towards the posterior side of the pig, we want to make sure that we don't get too center. We don't want to make the cut too much in the center here because we want to leave this portion of the skin attached. So my cut will run around, down the nipple line, and then just stay straight there so that we don't cut through this. We don't want to cut through this because there are vital organs underneath that we don't want to sever, that we want to be able to see later. Okay, so again, that cut's going to be from here, around, and down to about there. Again, being gentle at the first pass through. Okay. Using my fingers a little bit to tease it apart. Pull it apart. And the reason why I use my fingers is so that I don't have to use the scalpel too forcefully and maybe cut something underneath. Right, I'm not going to risk cutting anything with my fingers. Go back to the scalpel. Notice how I've left this intact down here. Right, so now I have this sort of flap that's left. The teacher's going to pause the video and she'll explain a little bit more about this incision. Our next incision is going to be now to sort of open up the abdominal cavity so that we can look inside. To do that, we're going to make some flaps on either side of the pig. So I'm going to show you how to make one flap on one side. You're going to do the same thing on the other side. So the way this works is you're going to take your scalpel, okay, and you're going to make two cuts. One is going to start down here at the posterior side. You're going to make a cut around the hip bone and down. Okay, around the hip bone and down. The other cut is going to be up towards the anterior side, towards the rib cage. You're going to start up here, and you're going to follow the rib cage down, okay, all the way down to here. Right, this is going to open up a flap that can then peel back. Now, as you're making your cut up here, keep in mind you're not cutting through ribs, so you want to be cutting next to the rib cage. You don't want to be cutting the ribs. Okay, that's not what we're dealing with right now. You're cutting now down just to the side of the ribs. Okay, you'll follow them down. Okay, so I'm going to start my cut down here. There's one cut. Okay, I'm going to feel, again, I'm going to palpate for that rib cage to make sure I'm not actually cutting any bone. Okay, so now you can see I've created a flap that's now given us much more access to the abdominal cavity, and we can actually now start to see some of the internal organs. And this flap is something that we'll just leave open to allow us to reveal the inner organs. You're going to want to do the same exact thing I just did on this side, on the other side, to create two flaps. So I'll let your teacher pause the video and explain a little bit more about this cut. Okay, what we want to do next is sort of give ourselves a way to mark this umbilical vein. Okay, so remember this vein that we were trying to avoid earlier on? Right? The reason why we were trying to avoid it is because we didn't want to sever it and then sort of lose where it was. Sometimes when you cut it, the umbilical vein can get tucked back down here and it's hard to find. So we do want to cut it, but we want to mark it first. So the way we're going to do it is we're going to take some string and we're going to tie it off. So we're going to take one piece of string, sort of run it underneath here, tie it. I'm going to tie one piece of string towards the umbilical cord side, so closer to this side. Right, I'm going to tie it like that. I'm going to take another piece of string. I'm going to tie it the same way, except this time I'm going to tie it closer to the liver side, closer down this way. I need to move the liver back just a tad. I'm going to make another tie down here. Okay, so once I've got that tied, then I can take my scalpel and I can make my cut through in between those two ties of the umbilical vein. So you want to go to do that, just make a nice sever. Now that that's severed, I've got my umbilical vein here, and I've got the other side here, easy to see with the string attached. It also now opens up this to flap back and allows us full access to the abdominal cavity. So I'm going to pause the video here, and your teacher can go ahead and give you further instruction on how to tie off the umbilical vein. Okay, now that we have exposed the abdominal cavity, we're going to go ahead and identify some of the organs that you're going to be responsible for knowing within the abdominal cavity. I'm going to start with this shiny tissue that runs along the entire wall of the abdominal cavity. So we can see it here, and we can kind of see it on the other side as well. Okay, this is called the peritoneum. This is what runs along the entire abdominal cavity. This sort of mass here is small intestine. So the small intestine is made up of all of this coiled tissue. Okay, that's small intestine. Right above that is a darker coiled snake-like organ called the large intestine. So this is the large intestine. Connecting the large and the small intestine is the cecum. And if I roll the small intestines back a little bit, I can find this finger-like projection right here. Notice how it's a finger-like projection that comes off of the large intestine and it dead ends. This is the cecum. Move up. There's a bag box-like structure that's sort of underneath the liver, this is the stomach. Attached to the stomach is a tongue-like projection called the spleen. So this is the spleen, and if I grab the spleen and sort of pull it a little bit, you notice that it's actually a fairly long organ. So this is the spleen, and it's connected to the stomach by a tissue called the greater omentum. So notice there's like a clearish tissue that connects the stomach and the spleen. This is the greater omentum. If I roll the stomach back and pull the large intestine forward, I reveal one of the harder to locate organs, the harder to identify organs in the abdominal cavity, and that's the pancreas. And you'll notice the pancreas has a very sort of obvious texture. It's got a sort of cottage cheese texture, and it's sort of a whitish color. This is the pancreas right here. Okay. Then we have the liver. The large brown organ is the liver. It takes up quite a large portion of the abdominal cavity. Underneath the liver, if I roll it back and I look under one of the lobes, I find a small pouch, sort of a darker, sometimes it's greenish, but in either case it's going to be a small pouch underneath one of the lobes of the liver. This is the gallbladder. Okay, so there's the gallbladder right there. Okay, so now I'm going to go ahead and let your teacher pause the video, and you can identify these organs on your own pig. Go.
The first part of the thoracic cavity dissection is identifying the diaphragm, which is right over here, this tissue, and detaching it from the ribs. So I'm going to go ahead and take my scalpel, and what I'm going to do is start at the very top, right over here. Now you can also start towards the bottom and make your way around, but I'm going to go ahead and start here. And you want to cut as close to the ribs as possible. Notice how I'm going down here. I can actually now grab the diaphragm, and grabbing it helps me cut it a little bit easier also. So I have half of it. Now I'm going to go up and start on the other side. Remember, cut as close to the ribs as possible so that you can get as much of the diaphragm exposed as you can. What we're looking at right here, this layer right above the liver, is the diaphragm. The next cut we're making is from the sternum to the top of the rib cage, and if you want to know where that is, you palpate for it and you feel a bone right over there. So the cut is going to go from here, the sternum, to the top of the rib cage, and then from here on I want to go down below the armpits and all the way down, same on the other side, below the armpits and all the way down, and then I want to connect these cuts right here so that I can have two flaps that open on the sides. So I'm going to take my scalpel and I'm going to draw these lines for you. I'm palpating. There's the top of the rib cage. Now you want to be careful because you have a lot of organs under there that you don't want to damage, including the heart. I want to take it from here. Remember to go underneath the armpits. I'm cutting through flesh. There are also ribs there, but I'm not cutting through the ribs right now. Same thing on the other side. Remember, we're going underneath the armpits. And then I'm going to go ahead and connect these cuts. We need to use our scissors because we're cutting through bone. So I'm going to start down here at the sternum. I'm going to cut up. Now, when you're using the scissors, you got to be really careful because right underneath is the heart and the lungs. And part of the heart, it's covered by something called the pericardium. As you're cutting, you're probably going to go ahead and cut through the pericardium, and that's okay. Just be really careful about the heart and the lungs. So I'm going to cut all the way down here, and now I've completed that cut. This layer you see right there is the pericardium that I've torn open. I'm going to continue my cut on this side. And then moving on, I'm cutting through ribs. Remember, you got to be really careful. The lungs are located right on the other side, so be very careful when you're cutting the ribs. I'm almost done with this cut. Cutting the ribs sometimes can take a little bit longer. Okay. I'm going to go ahead and remove this piece, put it off to the side, and I have this part of the body exposed. Your teacher will now pause the video and give you further directions. For my next cut, I want to start from the base of the chin, right down the center, and I want to work my way all the way down with my cut and connect all the way down to the top of the rib cage. So I'm going to take my scalpel and start where I mentioned, base of the chin, right down the center. You want to make sure you feel for the larynx so that you know where the center is. I want to make a very shallow cut. The reason I'm making a very shallow cut is because there are a lot of sensitive tissue and sensitive organs right underneath, and I want to make sure that I don't damage them at all. Okay, I'm going to try to use my fingers to pull apart the tissue. There's some areas where that's going to be easier. If I feel like my cut is too shallow, I'm going to go back in there and go over it just a little bit more, just to make sure that I get everything exposed. Again, I'm using my fingers to make sure I separate the tissue. Take the scalpel again to help me out just a little bit more. Take the probe and have the probe help you in pulling apart the tissue as well. Once you've exposed the throat area, your pig should look something like this. So let's go ahead and start identifying all the different structures. Starting down here, this football-shaped, almost brown-like structure is the thyroid. On either side of the thyroid, we'll see the thymus glands. If we move the thyroid aside, right underneath, that's the trachea. When I run my probe across the trachea, I can actually feel the rings of the trachea. And moving up, this large structure, that is the larynx. This is the diaphragm, superior to the liver. Let's move up to the left lung. You'll see the different lobes. The different lobes of the right lung as well. This is the heart. This tissue around the heart, this clear tissue, is the pericardium. And right over here, sitting on top of the heart, superior to the heart, is the thymus tissue. Now that I've identified all these organs on my pig, your teacher is going to pause the video and give you some time for you to identify yours. This is the organ dissection for the heart. So let's go ahead and identify some of the different parts before we make the main cut. This pointy part of the heart is called the apex. This line that you see running across the heart, that is a coronary artery. You may need to remove or just move over the pericardium, which is this thin tissue, over to the side so that you can see everything else. You'll notice that the heart has two auricles, which are like little tiny ears. Here's one, here's another. Moving the thymus tissue back up. The very first artery you see coming out right there, that is the pulmonary artery. Next to the pulmonary artery is the aorta. Let me also go ahead and show you the descending aorta. I'll need to take everything with my hand, lungs. I move everything over, and there is the descending aorta. I'll put everything back. I've shown you the pulmonary artery, the aorta, and now last, you'll see the superior vena cava. If I lift the heart, I can also show you the inferior vena cava. So now let's go ahead and make what's called a laptop cut. A laptop cut opens up just like a laptop, and you gotta be really sure, you gotta make sure that you don't cut the whole thing, that it still has a base attached. I'm gonna start at the apex. Gotta be gentle. You want to go straight down the heart. Okay, looks like I've gotten the tip of it exposed. Okay, give me just 1 second here and I can show you the whole thing. Okay, just like a laptop, it opens up, but the base is still attached so that I don't have it in two separate pieces. The heart is still one piece, but I can open it up. Okay, let's talk about the different chambers. The two bottom chambers are the ventricles, the two top chambers are the atria. This right here is the left ventricle. Remember, you're looking at it from the point of view of the pig, not yours. So this is the left ventricle. Here is the right ventricle. Moving on down further. And here you have the left atrium, the right atrium. This is the organ dissection for the stomach. So what I'll go ahead and do is, notice where the spleen is. Remember, it's attached to the stomach via the greater omentum. I'm going to point to it with my probe, and then I'll go ahead and do the dissection. So I want to start from one end of the stomach and cut through to the other end. Be really careful not to cut the spleen. So let's start down at this end. There might be some stuff in the stomach, and I'll tell you in just a moment what that is. Looks like part of it is coming out right now. The stuff you see coming out of the stomach is called meconium. Your teacher will talk to you about exactly what the meconium is. It's a little tough to dissect because there's a lot of meconium coming out of there, but just be patient and you will get it done. Okay. Now for inside the stomach, remember this stuff is called meconium. There are two different sphincters that we got to know about. The first sphincter is something called the lower esophageal sphincter. And that is located right over here. You can actually put your probe inside of it and follow the path to where the food comes from the esophagus, and that's why it's called the lower esophageal sphincter. This used to be known as the cardiac sphincter. The other sphincter is right here, and it's the one that attaches the stomach to the small intestine. As you can see, I'm putting my probe inside of it. This one is called the pyloric sphincter. This is the small intestine dissection of organ dissection. Everything we're looking at here is the small intestine. It looks jumbled up, but once you remove this from the body, it'll actually look very long. Now remember where the small intestine begins and where it ends. I'm going to lift it up. Remember the large intestine and the cecum. Let's look at this shiny layer of tissue right here. That's what we call the mesentery. So I'm going to take my scalpel and very carefully I'm going to cut that open. Now that I have my first cut, it makes it a lot easier to continue. Your job will be to do this to the entire small intestine until you can remove the whole thing from the body. Now it takes a while, so you got to be patient. And as you can see, I've started it. Your job now is to continue it and to finish it.
So what I'm going to show now is the kidney dissection for the organ dissection. Kidney dissection is a pretty simple one. We want to, again, make a laptop-like cut into the kidney to open it up so that we can see the inside. There's really only two parts. We're not going to get into a whole lot of detail. We just want to identify the medulla and the cortex. So I'm going to, first off, want to get the kidney loose so it's not very difficult to maneuver around. I want to be able to pick it up a little bit. So I'm going to loosen it. Then I'm going to take my scalpel and I'm going to make a laptop cut from one side to the other. But I don't want to go all the way through. I don't want to cut it in half. I just want to cut it so that it hinges open. I'm going to take my scalpel, flip the kidney onto one side here, start my cut. want to test to see if I'm deep enough, and yes, I am. So if I now flip this open, I can identify the different spots. So let me just point those out to you. Okay, so we notice there's a color difference, which makes it easy to identify. So this gray material on the outside, running all the way around the outside, okay, that is the cortex. So all this gray is the cortex. The white on the inside is the medulla. So we got cortex on the outside, medulla on the inside. The urogenital dissection is one that is slightly different for the male and the female pig. I'm going to show you on the female pig first, and then I'll show the male pig dissection for the urogenital system. So I have my female pig here, easily identifiable by the urogenital papilla. My first step is going to be to make an incision right down the middle here between the legs. This is going to sort of help us reveal the pelvic bone. So the organs that we want to identify on the female pig actually run down in the middle of the pelvic bone. So we're actually going to have to get through that bone to reveal those structures. So I'm going to want to use my scalpel first to cut through here. Then I'm going to want to break the bone. I can do that with my fingers actually by pushing down on the hips of the pig. And I'm going to need to use some force because it is a bone to crack that. But then once I crack it and I've exposed it, then I can use my forceps to then start to pull away the bone to reveal the organs that we want to identify. Okay, so I'm going to go ahead and start that with the scalpel and show you guys how to do this. I'm going to take my scalpel and I'm going to come down the middle here. Once I've kind of opened it up, I can sort of use my fingers a little bit, and you can sort of feel where that bone is. So there's a bone down here that I want to feel for. This is the bone that I want to ultimately get through. So I can use my fingers and literally just push down, spreading the legs apart so that I'm now revealing it a little bit more clearly. So now I feel the bone. Now I can feel where I need to sort of use my forceps to sort of get through. So I want to take my forceps and I just kind of want to go in here with them and start pulling the bone back. So I'm just grabbing bone, just sort of pulling it back. It's going to take a little bit of force. I just want to sort of start lifting that up. And as I do, I'll start revealing the underlying parts that I want to see. This might take you a while because the bone is kind of tricky to get through, but you want to keep working at it. Okay, now I'm starting to get close, and I can now actually start to see the tubes that I want to see. So these are the female reproductive tubes, or one of them is the female reproductive tubes. So I can point them out at this point. So as I clear this away, notice I can get my probe under here and I'm now seeing these tubes right here. This is what I want to reveal. So the pelvis was actually on top, sort of covering this up, but I pulled it away to reveal these tubes. And I'll identify these tubes in a second. But what you want to do first is actually do the dissection to clear this area up. So I still have more work to do here to clear this up so that I can have a clearer view of these tubes. Okay, so I'm going to go ahead and pause the video here, and your teacher's going to follow this up with some instructions on how to do this dissection. Now that I've exposed the 3 tubes, right, I've kind of gotten through this pelvic bone, I've separated it out. These are sort of clearly able to see the tubes now. I want to identify these. What I'm going to do is I'm going to start from the most ventral tube going down to the most dorsal. Here we have the urethra. The urethra is the most ventral tube. It's directly connected to the urinary bladder. Okay, so the urinary bladder, remember, is over here. And if you notice, on either side of the urinary bladder, we have the umbilical arteries. So the two tubes running parallel to the urinary bladder on either side are the umbilical arteries, the urinary bladder right down the middle. Okay, so the urinary bladder is connected to the urethra. Dorsal to the urethra, we have our second tube. This is the vagina. Now the vagina, if I trace it upwards, is connected into the fallopian tubes. So these these very small, narrow, squiggly tubes are the fallopian tubes. Okay, so these are the fallopian tubes here on either side. Sort of the vagina, once it connects to them, they branch out into two separate tubes on either side. These fallopian tubes connect into these small, dark, round organs. These are the ovaries. So I have one ovary here, another ovary there. Right. Now, it's worth noting, but it's very difficult to see, is the uterus. The uterus is actually at the junction of the fallopian tubes and the vagina. So it's a small, very difficult to see triangular region. I'm pointing to the area where it is, although it's very difficult to see. It'd be approximately right here is where the uterus would be. Okay. You might want to try and find that on your own pig. So going back, so again, we have urethra, vagina, and finally, our last tube down here at the most dorsal side is the rectum. Okay, the rectum is definitely the largest of the tubes. If I trace it back up, I connect it into the large intestine. And if I trace it to its exit, it exits out of the anus. So if I take my probe and I stick it into the anus, I can actually trace that up into the rectum. So I know that that's the rectum. Something worth noting, and this is a difference between pigs and humans, an important difference. In a pig, we have the urethra and the vagina ultimately coming together to one tube. So these actually converge into one tube that exits out of the urogenital opening. So notice if I stick my probe in the urogenital opening, right, I find myself in that connected tube between the urethra and the vagina, one way towards the urethra, the other way towards the vagina. In a human, these tubes stay separate the entire way down. So what a human would have would be two holes exiting the body, not just one like in this pig. An easy way to maybe remember the order of these tubes is UVR, meaning urethra, vagina, rectum. Okay, so I'm going to let your teacher pause the video here, and she'll sort of further instruct you on what you're going to do, but you should be able to identify all these things on your own pig. For the male urogenital dissection, unlike the female urogenital dissection, we're not actually going to be cutting through bone. We don't need to get through the pelvis, but we do still want to make it easier for us to do the dissection. So what I'm going to do, like I did on the female, is I'm going to get the legs to be spread, so I can just push down on the legs on either side, so that now I have better access to the area I want to dissect. So the main task is to remove the scrotal sacs from the scrotum. So the scrotum is down here. Okay, so on a male we can see the scrotum. It's this tissue, this pouch that holds the two scrotal sacs, which hold the two testes. This is on a male only, not on a female. But the scrotal sacs are inside of this pouch. Now, instead of cutting into the pouch and trying to dissect it out that way, I want to leave the scrotum intact. So the way I'm going to get the scrotal sacs out is by pulling them out. So I find what I want to look for are the Vas Deferens. So these tubes. Okay, so here's one tube, and on the other side here's the other tube. Okay, these two tubes run to the testes. What I can basically do is grab these tubes and sort of pull on them to help pull out the scrotal sac, but it's not going to come out really easily. I'm going to have to use my probe to sort of widen the hole and dig in a little bit to give myself good access and clear up the way to pull it out. So I'm going to grab onto one of the Vas Deferens and start tugging on it at the same time as I'm loosening up the area around. What you don't want to do is pull too hard. If you do, you can actually snap the vas deferens, and if you do that, then the scrotal sac is going to be stuck back there, and you're going to have to actually cut it out, which is what we want to avoid. So I'm just going to go ahead and grab this and start pulling, and use my probe to kind of dig in a little bit, make the hole a little bit wider. Notice how I'm pulling it, and now you can start to see some progress. There we go. There we go. So as I pulled out one scrotal sac, if I go to the other side, I can do the same thing with the other scrotal sac. Now, before I let you get started on that, I want to do a quick dissection to show you where the penis is. Now the penis is running along the tissue here, right below the urogenital opening. So the penis is running along inside here. If I take my fingers and I palpate along that tissue, I can feel a hard tube. That's the penis. Now to get it out, I'm going to have to potentially use my scalpel, but I may only need to use my probe to sort of pull away some of this tissue. So if I use my probe and I start pulling away some of this tissue, start to see this white tube right here. Okay, so this is the penis. Now I'm going to let you go ahead, pause the video, and your teacher will give you further instructions on how to do this dissection. Now that we've removed both scrotal sacs from the scrotum, which remember is back here at the bottom, this pouch back here. So we've removed these scrotal sacs from the scrotum. We can go ahead and identify some of the organs of the male reproductive system. In order to do that, I'm going to actually have to cut open one of the scrotal sacs. So what you're going to want to do is pick one of the two scrotal sacs. We want to leave one intact. The other, we want to cut open the scrotal sac to reveal the organs inside. Now to do this, I'm going to want to take my razor, my scalpel, and gently make a cut along the scrotal sac. Remember, the testy is right underneath this, so I don't want to cut into it and damage the testy. So I'm going to take my scalpel, make a very light cut along the top of the scrotal sac. And I can really use my fingers to sort of pull that apart where I made that cut. Okay, now that I'm pulling this apart, I'm going to start to reveal the underlying organs. And actually I need to go back to my scalpel just a bit. Okay. There we go. So now that I've sort of peeled back the scrotal sac, I can see the testy. So this dark sphere, this organ here, this is the testy. Flip it over to see on the other side. There's the testy. And around the testy, so this structure here, it goes 360 degrees around the testy. This is the epididymis. So you have the testy surrounded by the epididymis. Connected to the epididymis is the vas deferens, which we saw earlier. That's the long tube that runs away from the scrotal sac. Following it down, the vas deferens runs all the way. So here's the vas deferens running away from the scrotal sac, all the way down this way. This ultimately will connect into the penis. Remember, the penis is over here. So the vas deferens connects into the penis. What also connects into the penis is the urinary bladder, which remember is right here, in the same spot on a male as is on a female, urinary bladder. So the urinary bladder is connected to the penis via the urethra. Now on a male, the urethra is actually inside of the penis, so we can't identify it as easily on the male like we could on the female. But just know that the penis is connected to both the urethra and the vas deferens. So that will run through the penis, ultimately exiting out of the urogenital opening, which remember is up here. Okay, so now I'm going to allow your teacher to pause the video so that you can identify these parts on your own pig.